Differentiated lymphocytes producing immunologist. Plasma cells. Plasma cells differentiates the lymphocytes, or the lymphocytes are actually the differentiation or modification of plasma cell. Eosinophil inclusions are the are known as curl of body. Curl of body are the eosinophilic inclusions, and plasma cell differentiates lymphocytes, or lymphocytes in actual are the differentiated plasma cells, or their precursor is plasma cell. Curl of body has the eosinophilic inclusion. Babesiosis in cattle has linked with Russell Viper venom time. I do not understand that point, but according to that, babesiosis in cattle is linked with Russell Viper venom time. Russell Viper venom in actual is the venom of the Russell Viper that has the ability to clot the blood, and it has been used in medical field also to clot the minor trauma etc where there is a bleeding. So it was also used to stop the bleeding in a minor cuts, abrasions etc, as the injury by surgical blade etc, or by the any other sharp object. Russell Viper venom was used in past to stop the or to clot the blood. So it is linked with babesiosis in cattle. Anaplasma in cattle, or anaplasmosis in cattle has extravascular hemolysis. Anaplasmosis or anaplasma by anaplasma marginal as an example, species as an example, causes extravascular hemolysis, and babesiosis in cattle is linked with the Russell Viper venom time and eosinophilic inclusion. Eosinophilic inclusion is in curl of body, or curl of body has the eosinophilic inclusions. Anaplasmosis in cattle has extravascular hemolysis. Red blood cells with no central pillar, it means center is not pale and smaller than normal. The red blood cell that is smaller than normal and it is not pale or faded reddish from the center, it is the spherocytes. Spherocytes or spherocytes are the red blood cells that are not fade from center, or pale from center, or paler center, and are smaller than the normal size. 16 micrometer is the size of the red blood cells of sheep, goats. Red blood cell has 16 micrometer, and if the goat having the less than 16 micrometer size is red blood cell is less than 16 micrometer, and it is not paler from the center, or not faded color, not a reddish color, uh, no reddish color, and it has the reddish color, it is not paler or it is not faded. The red blood cell is less than 16. In case of goats, the red blood cell is less than 16 micrometer, and it is not paler or not faded from the center, then it will be the spherocyte. Spherocyte is the red blood cell with no central pillar and smaller than normal. Anaplasmosis in cattle has the extravascular hemolysis. Russell Viper venom time is linked with babesiosis in cattle. Eosinophilic inclusion are in spherocytes, or spherocytes are the eosinophilic inclusion, have the eosinophilic inclusions. Differentiated lymphocytes are differentiated from plasma cells, and fragment of red blood cells are schistocytes. Schistocytes are the fragmented red blood cells. We stated earlier that schistocytes are the fragment of red blood cells, and spherocytes are the schistocytes are the fragmented red blood cells, and spherocytes are the smaller, no central pillar red blood cells. The difference between spherocytes and schistocytes. Schistocytes are the fragmented, and the spherocytes are smaller and no pillar central. And test using recipient's plasma. In case of major cross or minor cross, we have to only remember that we have to remember the major cross, and in major cross, if we are the donor and we are donating our blood to any patient, then if our cells are being considered or tested, then it will be the major cross. Major cross will be the cross if the donors cells are being tested. So from 112 and 112 and 13, test using recipient's plasma and donor cell. If I am the donor, my cells are being considered, then it will be the major test cross. And the test using donor plasma cells and recipient cells, if I am the donor, my cell are not being considered, so it will be the minor test cross. Immunological immunoglobulin filled vacuole in cytoplasm, vacuole in cytoplasm of plasma cell. If the plasma cell has a vacuole and this vacuole has the immunoglobulin, then it will be the Russell body. So the difference in spherocyte, schistocyte and Russell body is the Russell body is not the red blood cell linked with red blood cell. Russell body is linked with plasma cell. If the plasma cell has a vacuole and this vacuole has immunoglobulins are of 5 types: G, A, M, D, E. So these are the 5 types of immunoglobulin. If any of them immunoglobulin is within the vacuole of the plasma cell, then it will be the Russell body. And the difference between spherocyte and schistocyte is that schistocyte is simple, the fragmented red blood cell, and spherocytes are the red blood cells that are smaller than the normal. For example, if the normal size of the red blood cell of goat is 16 micrometer, if the red blood cell is smaller than 16 micrometer, 12 micrometer or 10 micrometer, and it is not paler from the center, then it will be the spherocyte. And anaplasma in cattle is causes extravascular hemolysis. Babesiosis in cattle is linked with Russell viper venom time. Russell viper venom is famous for clotting the blood. Eosinophilic inclusions. Eosinophilic inclusions are the curl of body. Curl of body are the eosinophilic inclusion. It should also not be confused with spherocyte, schistocyte, or Russell body. Eosinophilic inclusion, it is related. Eosin means red loving. It will be the blue color cells. Basophilic cells are seem to be reddish. Eosinophilic cells seems to be the eosinophilic seems to be bluish, and basophilic seems to be the reddish color. Eosinophil loves eosin. Basophilic loves basophil. If basic color blue is the basic color, blue loving, it will be the red. Eosinophil, they are the bluish color. So bluish color inclusions are in curl of body. Curl of body is the eosinophilic inclusion. Differentiated lymphocytes producing or simple plasma cell is differentiated into lymphocytes, or the lymphocytes are the precursor of lymphocytes is the plasma cell. Next, hemoglobin contains 4 atoms of iron and 8 atoms of sulfur. The amount of sulfur is double to that of the iron in hemoglobin. So iron is important as oxygen binds with the iron. So one molecule of hemoglobin has 4 globin molecules. Each globin has an iron molecule, and this iron is responsible to bind the oxygen. So a hemoglobin can bind 4 oxygen molecules, but despite of that fact, the amount of sulfur is double than that of the amount of iron, and it is 8 atoms of sulfur. And onion is a rich source of sulfur. So onion may have the importance with that the chemistry of red blood cell, that the red blood cell has the 4 atoms of sulfur. The molecular weight of hemoglobin is 68,000. 68,000 is the molecular weight of hemoglobin. We can remember it with that fact that the 8 molecules are of sulfur. So 8 number can be remembered from that fact. And the pig has rapid growth and poor iron reserve, and it has increased iron requirement for erythropoiesis. Pigs require the fortification of iron or the external supplementation of iron, whereas the ruminants and other animals, they usually do not require ruminants do not usually require the extra supplementation of iron, whereas the pig requires the extra supplementation of iron as it has the rapid growth is also in other animals and ruminants too, but it has a poor iron reserve. Pigs have the poor iron reserve, so they require the fortification or the iron and to be provided from the diet. Plumbism is the poisoning of lead. The lead is denoted as Pb, and the poisoning of Pb is plumbism. Anaplasma marginalis is an intracellular parasite, is referred to as marginal bodies. As the name indicates, anaplasma marginal means it will be on the margin, so it is also referred to as the marginal bodies in the red blood cells. Aplastic anemia is associated with Bracken-Fern poisoning. Bracken-Fern poisoning leads to aplastic anemia that may lead to death. And there are also the hemorrhages in Bracken-Fern poisoning. On post-mortem examination, if we see the hemorrhages, then we can suspect it for Bracken-Fern poisoning, and we can differential diagnose. Another diagnostic pointer is that there will be the aplastic anemia. Basophil and mast cells are the source of indigenous heparin. Basophil is a type of white blood cell that is granulocytic white blood cell. Other type of granulocytic white blood cells are basophil, eosinophil, and neutrophil. So basophil along with mast cells are the source of indigenous heparin, and heparin is the blood clotting clots the blood, is responsible for clotting the blood. So basophil and mast cells are the source of indigenous heparin. Aplastic anemia is associated with Bracken-Fern poisoning. Bracken-Fern poisoning also causes the hemorrhages, and in deer, the normal shape of red blood cells in deer is sickle shaped, whereas the sickle shaped in humans may lead to the sickle cell anemia, a disease. So sickle cell in red blood cells in deer, it is a normal phenomena. Their normal cells are sickle shaped, and deer sickle cell erythrocytes is naturally occurring morphological variation. It is the normal cells of deer, red blood cells of deer are of a sickle shape. The plasma protein fibrinogen is used to detect inflammation in large animals, or simply fibrinogen is the inflammation detector. Inflammation can be detected in large animals by detecting simply the fibrinogen. More the fibrinogen, more is the inflammation; less the fibrinogen, less is the inflammation. So inflammatory response detection can be through the fibrinogen concentration. Blood proteins are produced by hepatocyte, leukocytes, and vascular endothelium. Vascular endothelium is the lining of the vessels. So blood proteins are produced by the blood carrying system or the vascular endothelium. Hepatocyte cells of the liver, and leukocytes, the white blood cell leukocytes, as the that the lymphocytes can be differentiated into T cells and B cells. T cells secrete cytokines or inflammatory mediators, and these inflammatory mediators as interferon, gamma, temporal necrosis factor, interleukins. There are also the blood proteins, and they are secreted from leukocytes, and special leukocyte that is involved with in inner cell regulation against the pathogens is by the cell mediated immunity by the proteins as interleukin, interferons, tumor necrosis factors, etc. So hepatocytes are also involved in blood protein synthesis. Vascular endothelium is also involved in blood protein synthesis. Plasma protein fibrinogen is the inflammation detector, can be used to detect inflammation. Deer has sickle-shaped erythrocytes. Basophil and mast cells are the source of indigenous heparin. Heparin can be obtained from basophil and mast cells. Aplastic anemia is associated with Bracken-Fern poisoning. Smooth endoplasmic reticulum is the major source of intracellular storage set for the element calcium. Smooth endoplasmic reticulum is the major the calcium is stored intracellularly in the smooth endoplasmic reticulum. Calcium is stored within the cell in the endoplasmic reticulum, and especially the smooth endoplasmic reticulum. The movement of lipid soluble substrate through the cell's membrane is by the process of diffusion, or the movement of cells without movement of substrate or anything against the concentration gradient is by active transport, and the movement of anything from the region of higher concentration to the region of lower concentration is the diffusion. So the lipid soluble substance through cell, that the cells itself, they are the lipid bilayer. So lipid can pass through the lipid. So the lipid soluble substrate through the lipid membrane by process of diffusion, as though no energy is required. Spleen is called the graveyard of red blood cells. Spleen is the graveyard of red blood cells. Gallbladder is absent in horse. Horse do not have the gallbladder, and gallbladder is the storage site for bile. Bile is synthesized in liver. Bile is synthesized in liver and is stored in gallbladder in the animals that have the gallbladder. Horse do not have gallbladder, so horse cannot store its bile. Whereas humans can influence, they can store their bile that is secreted from liver. The specific gravity of bile is 1.010. 1.0 or approximately 1 is the specific gravity of bile that is secreted from liver and stored in gallbladder, and gallbladder is absent in horse. Bile is bitter in taste. Taste of bile is bitter in carnivore. Bile is golden yellow color. Carnivores bile is golden yellow color, whereas the humans and normally bile is greenish in color. But the golden yellow color or yellowish color, bright yellow color, this color that is same as that of the sun color is the color of bile in carnivores, as lion, tiger, leopard, etc. Cholerectic increases secretion of bile. Choleractics can be used to increase the secretion of bile during rumination, and bile is, I think, associated with the digestion of lipids, but not sure. And the bile is secreted from choleractics during rumination. The number of ruminoreticular cycles per minute is one cycle per minute is the ruminoreticular cycle. Ruminoreticular cycle is 1 per minute. Choleractic increases bile secretion. Bile color is golden yellow. Bile is bitter in taste. And the naturally placenta is expelled within 4 to 8 hours of parturition. In cattle, loss of 7 to 10% of body weight results in death. Chloride shift is also known as hamburger phenomena. Hamburger phenomena is associated with red blood cells in which the chloride enter or exit the red blood cells by this hamburger phenomena. Loss of 7 to 10% of body weight can result to the death, and the normal placenta is expelled within 4 to 10 hours of the cattle. During rumination, the number of ruminoreticular cycles per minute is 1. Choreotics are the drugs that increase the secretion of bile in carnivores. Bile is golden yellow colored. Bile is bitter in taste. The specific gravity of bile is 1. Bile is synthesized in liver. Gallbladder is absent in horse. Spleen is called the graveyard of red blood cells, and diffusion is the movement of molecule from the region of higher concentration to lower concentration without use of energy. Smooth endoplasmic reticulum is the major storage of calcium. Calcium is stored in the cell. In the smooth endoplasmic reticulum, the blood proteins are hepatocyte, leukocytes, and vascular endothelium. The plasma protein fibrinogen is used to detect inflammation. Inflammation can be detected by fibrinogen. Deer red blood cells are sickle-shaped. Basophil and mast cells are source of indigenous heparin. Heparin is the blood clotting protein, aplastic blood anticoagulant. It is anticoagulant. Basophil and mast cells are secreted from that. Heparin is the heparin is the blood anti-clotting protein. Aplastic anemia is associated with Bracken-Fern poisoning. Bracken-Fern poisoning causes hemorrhages. So if there is any animal that is suspected and for any poisoning and have hemorrhages and aplastic anemia, then it will be have the Bracken-Fern poisoning. This should also have to be differentiated diagnosis. Anaplasma marginal is also referred to as having the marginal bodies. Red blood cells having marginal bodies can be suspected for anaplasma marginal. Plumpism is the poisoning of PB or lead. Pig has a rapid growth rate and is deficient of iron, or it cannot store iron, so it requires the fortification or the external diet having the iron. Weight loss, the molecular weight of hemoglobin is 68,000, and the hemoglobin has 4 iron and 8 atoms of sulfur, and the hemoglobin can bind 4 oxygen with 4 iron of the 4 globin molecules. Differentiated lymphocytes are from the plasma cells, the eosinophilic in inclusion is the curl of body. Curl of body is the eosinophilic inclusion. Babesiosis in cattle is the Russell Viper. Venom time anaplasmosis in cattle leads to extravascular hemolysis. Red blood cell with no central pillar and smaller than normal the the spherocyte. Spherocyte is the red blood cell with no central pillar and smaller than normal. Fragment of red blood cell is the schistocytes. Immunoglobulin filled vacuole in the cytoplasm or plasma cell. Plasma cell having the vacuole and this vacuole having immunoglobulin. Then this cell will be called as this plasma cell will be called as a Russell body. Russell body is not the anomaly of red blood cell. Remember that mostly anomalies are of the red blood cells, very less are as the Russell body is the anomaly of plasma cell. And the eosinophilic inclusion, as it is the white blood cell linked, it is called as curl of body. Immunoglobulin and the test using plasma, major test cross and minor test cross. Major test cross is the test cross in which if I am the, for example, I am the donor, I want to donate blood to anyone, and if my cells are being tested, then it will be the major test cross.